What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Welcome back to Beyond the Scripts. I'm your host, Will Tuff with Pioneer RX. And it seems that there are definite geographical hotspots in the country where we have guests on again and again from the North Carolina region. And it seems even more and more recently, the Pacific Northwest. Joining us today is Chris Schaffner from the Pacific Northwest, where we've had, again, a few guests from lately, but just a lot going on in Washington. And interested to hear your take on, is that a coincidence? Why do you think that is? And look forward to hearing about your pharmacy. So thanks for joining us, Chris.
Oh, thanks, Will. It's an honor to be here. I was thinking about that too. Like, why are there so many people from Washington recently? And I kind of figured you guys are just trying to save on shipping costs for the Pelican case. You know, if it
that factors in.
Area. Yeah, everything's more expensive these days. So I was less flattered to get it. I just figured it was more of a budget thing this time.
I think a lot of that really does come down to the community of independent pharmacies and how just independent pharmacies outside of any larger organization really tend to communicate and work together so much. But you definitely see those communities where, forward-thinking pharmacies are able to advance the industry, even if it is, geographically kind of isolated at times, but that definitely expands. And it's exciting to, focus on that and get the word out and see what's going on up there.
Oh, absolutely. 100% agree. I think networking is everything. So having that professional network, especially if they're close by and you can meet for lunch to bounce ideas off of each other. And that's why, conferences and things like that, especially post-COVID, are so important. We've got NCPA next week, and, it's a way to build on that network. And there's so many incredible people in independent pharmacy that are doing great things. So to build relationships and learn from them. I know, I'm not even close to the smartest guy in the field, but I'm happy to know some smart people, and they've truly helped me out a ton. You've got Nicolette Matthews and John Hires out there that inspire me to do things. And so, without them, I think my business would be several years behind where it is today. So yeah, it's a really cool community, no doubt.
Yeah, a fun story. I love John, and I actually installed his pharmacy when I was on the installation team years and years ago, and it was just such a neat pharmacy to be in. He had a great energy, and it's funny you can pick out those people who are passionate about what they're doing and doing it for the big reasons, the bigger whys.
Oh yeah. Him and I have a good time. We blast each other on social media, and like whenever something cool happens, we have to brag on each other. And he's pretty good at outdoing me, so I'm going to save a couple big wins up and send him his way, hopefully soon.
Well, you've had quite a few big wins as of late, right? So Schaffner Pharmacy, tell me a little bit about that. I went to Google Street View and drove around your town, and it is incredibly picturesque. You're about an hour south of the Canadian border, I guess. Just beautiful landscape. It looks like an amazing community. And you've recently moved into a new building. Tell me a little bit about the pharmacy itself. Yeah,
you're exactly right. We're about an hour south of the Canadian border, about an hour north of Seattle, so sandwiched in there. The Pacific Northwest is beautiful in its own right. We have the mountains 30 minutes from the pharmacy. The water's 20 minutes away. So really kind of, I think there's a lot of beautiful places in the country, but this is one of them. And so, our town for the most part is, I think still rural, about 11,000 people, but it's actively growing as we see people push out of Seattle and, more people are working remotely. They're looking for this exact type of community. And so it's kind of the perfect situation for us where we've really become, just like most independent pharmacies, a major part of the community and the healthcare delivery system within it. And so, we acquired a building that was an old bank. It had been vacant for several years. So we gutted and remodeled it, moved into it July 18th. And along with the pharmacy, we opened up a coffee shop called Apothecary Coffee, within the space as well, which is something I've always wanted to do, but our previous space just didn't allow for it. So it's been a really fun journey. Getting into the coffee business, totally different than prescriptions, where you can set your own price and there's no audits, TIRs. Nobody comes back and audits you on a latte 6 months later. So it's been really fun. And to see how the two businesses are symbiotic and how it really changes the sort of the culture and the feel within the pharmacy and relaxes people, it's been such a cool journey. So.
Yeah, I mean, that's such a kind of a natural fit with the coffee culture and that part of the country is, kind of ever present. And you're right. I think it does kind of slow it down a little bit and make it more of even more of a community hub.
Absolutely. I think, when we look at what our pharmacies do, I mean, especially in smaller towns, the pharmacy a lot of times is sort of a social gathering place. I mean, how many times do you have patients in line to pick something up and, Jim's behind them and they start talking about, what happened at the football game last night or whatever it might be. And so the coffee just really helps to increase that feeling, that vibe. And so people are coming in and just hanging out, sitting by the fireplace now. And we love that. And so, you have patients waiting on vaccines or waiting on prescriptions. They'll grab a cup of coffee with their spouse or their friends. And it's kind of heartwarming to see that, because when you're remodeling the place and you're spending all this money, you're hoping people use it. It's kind of like throwing a party or just a really expensive party and hoping somebody shows up. So it's been a ton of fun. I'm really enjoying it.
Yeah, I remember installing a pharmacy in a small town in Texas called Owl Drug. And that was one of the neat things about that pharmacy. It was a small town and they had the, little diner. But it was the coffee that brought the same group of people in every morning. Every morning they have the coffee crews. And it is such a unique part of, culture and just spending time in your community. It's funny how coffee and, I guess pubs to a different extent can do that.
Absolutely. Well, that's the next step, right? Like we got to go into beer and wine. But truly, I mean, those things, they break down communication barriers. They make people more comfortable. And that's what healthcare is all about, right? Is developing those relationships, being able to talk to patients without that sort of clinical or intimidating barrier that they feel in a lot of other settings. And that's why independent pharmacy can make such tremendous interventions, is we have those relationships. So it's just taking it one step further. And if you don't have the space to do a coffee shop, you can do it other ways too, by just making sure that the ambiance in your lobby is welcoming and inviting for people to come and spend time, the place they want to be.
Yeah, I mean, when you compare that against other aspects of a patient's healthcare journey, that is a stark difference than, sitting on the crinkly paper in the physician's office, right? Like that is night and day. And I think that's going to open up a completely different level of communication with whoever you're talking with.
Absolutely. And it's kind of, COVID really advanced pharmacy maybe even a decade ahead of where it was. And so being seen now as a true healthcare destination, it's nice to change that feel. So they come in and they're immediately at ease. This is a place they want to seek, healthcare. So as we continue down that journey and medical billing is something we're really working on right now, hopefully that eases that transition for us.
Yeah. Yeah. So it's interesting too. You're in an old bank. I was talking with somebody at a trade show this summer. And they were like, yeah, I'm looking at this old building. It used to be a bank, so I'm a little nervous about it. I'm like, what do you mean? That means they've already done so much research to the location and how it should be positioned. The architecture of a bank is designed to convey stability. That's one of the common factors. Not to mention they generally have a great drive-through.
You're exactly right. Yeah, if you start looking at new construction and putting drive-throughs in and impact fees and all that stuff that counties and cities make you pay, if you can find an existing location with that already built out, and you're right, the interior of a bank is set up very similar to a community pharmacy with the way the counters and the lobbies are arranged. So yeah, I think they're great. They're great. What do you call it? Sort of transition pieces if you can find one. So it seems like banks turn over like crazy. So just keep your eye out.
And you have a great C2 cabinet built in, right?
Absolutely. Except for, the door to the safe is so darn heavy. I'm really scared to close it because if I can't figure out how to open it, I don't know who in the country can. You got to call like Ocean's 11 to come out there and crack that thing. But.
Yeah, fair enough. So how long have you guys been in that location?
We came in July 18th. So it's just been a month and a half, 2 months here. So we're finally settled in, and all those projects that we had to table, prior to the move, as we focused on getting everything moved over, we're able to pick back up and kind of dive in, which is just in time for, Omicron boosters and flu season to come out, which has been a big push for us, trying to make sure we're vaccinating as many people as possible. I think that's something that most independents are doing right now, but really focusing on not just the vaccine they're there for, but putting in additional screening measures to make sure that if they need a hepatitis or a pneumococcal or shingles vaccine, that we're able to get them on schedule, prepared to receive all that at once, so that we capture that visit and make the most of it.
Wow. So I guess in that time, then, if you've only been in there a few months, that means that throughout COVID, on top of doing all of those immunizations and testing and social distancing and all of those challenges, that means you were also shopping for a new location, remodeling. How long were you open prior? What's the history of that Schaffner Pharmacy prior to this location?
Yeah, so the pharmacy is about 4.5 years old. And so we were in our previous location, which was within a clinic building. The clinic was a great partner to us. I think it was very symbiotic, us helping them and them helping us. And so, yeah, we opened in April of 2018, started off with a pretty good following already, pretty good patient base. So made that startup phase quite a bit easier. But then in June of 2018, I was actually diagnosed with stage 3 Hodgkin's lymphoma. So that definitely threw a curveball into the business plan. It's something
wow.
That stage of the game, you can't really afford to hire another pharmacist. So I think I remember getting the call from my primary care physician after we did a routine CT scan, and him telling me that he thought I had cancer. And I remember just kind of leaning against the bathroom door thinking, gosh, is my business going to survive? I probably should call a lawyer today and make sure that, all the licenses are going to pass to my family. How does that all work? Things that you never really think about. So that made up the first 8 months of our journey as a new pharmacy, surviving not just, startup phase, but surviving cancer as well. Getting on the other side of that. And, we had about a 3 or 4 month kind of break, and then COVID hit, and we started the craziness that everybody experienced with that.
Yeah. So I'm not a psychologist, but I was a psych major for a little while. But you just completely compartmentalized a very personal, medical struggle, and made like a business management assessment of everything first. Was that like how you dealt with that difficult news, kind of just to compartmentalize and say, okay, how do we move forward? Or, because that's an interesting way to handle that kind of news.
Yeah, no, that obviously that wasn't the entirety of like the mental thought process. That was just, I think, as pharmacists, at our nature, we're extremely practical, right? And
yeah.
And so that was the practical side of the brain thinking, you better get your ducks in order in case you don't, you check out of this world here pretty soon. But there was the full range of emotions, and I certainly had my pity parties and the why me's and hey, we're doing good work, why would this happen to me? But at the same time, I think in some ways I kind of had prepared my whole life for that, pushing myself, pushing my body. It sort of prepared me for the mental and physical battle that chemotherapy was. And I'm glad if it had to happen to somebody in my family, I'd want it to be me, right? Like I think that I'm maybe better suited for that type of struggle than anybody else around me. I certainly wouldn't want my family to go through it. So it was not an easy journey, but one that I'm glad in the end I went through, because I learned a lot more about myself and what I'm capable of. I think I'm a firm believer that everybody should do something really, really hard, like at least once a year, to push themselves and prove to themselves that they can do more than they ever thought. And that was just that wasn't a voluntary thing. That was just kind of forced on me. So that was my thing for 2018. And maybe we'll just like run a marathon or something this year and make it easier.
Yeah. Wow. What a way to look at that, as, here's a challenge I'm going to overcome. And I can only imagine that, as a pharmacist who's, coaching and working with patients that are facing those same obstacles day in and day out, that kind of personal experience, if you take it in stride and take it with that attitude, can only make you a better, healthcare rock for that patient base.
100%. You're exactly right. To see the healthcare system from the patient side and the frustrations just with scheduling and prior authorizations. We see it on the prescription side, but talk about those sort of delays with scans and imaging tests, which are, the amount of anxiety that goes into them for the patient themselves, and then to be waylaid by insurance. It is incredibly frustrating. So I really learned that you have to be your own best advocate in healthcare to sort of keep those sticky wheels moving. And so telling patients that, and I think now I'm definitely more compassionate than I was. It's pretty easy in healthcare to be calloused, and after doing it for years and years, to get burned out. So I have a new appreciation for the patient struggle and how tough it can be. Absolutely. And, the interesting thing was, I recovered from cancer. A few months later, I hired another pharmacist. She was fresh out of school, to kind of start part-time. 3 weeks after she started with me, she was diagnosed with a different type of lymphoma, but the same stage. So she went through that process. I don't know what it is, like why pharmacists have such bad healthcare tracks in my pharmacy. If you're out there and you want to work for me, maybe seek employment elsewhere. But I was able to help her through that as best I could. And, now she's doing great. So, it's such an interesting journey for both of us.
Wow. Yeah. So, okay. So this is 2018. You're taking this on. Were you at an independent prior to that, or was this right out of school? I'm going to go open a pharmacy, or how'd that come about?
No. I'm way older than I look. I've got great skincare routine. So I was managing an independent pharmacy straight out of school in 2000. I graduated 2007 from the University of Washington, managed an independent for several years until it was acquired by a hospital system, and then helped manage pharmacies for them and manage their 340B side of things for about 10 years before we decided to open our own store. So, I'd been around the industry a lot, mostly on that sort of independent community side. But had some experience before we started. So, it's been an incredible journey. The pharmacy career has been really good to me. I've learned so much, met so many great people. So I'm very thankful for it.
Nice. So let's fast forward to 2020 or so. So you have a independent pharmacy. You're doing well. Are you doing primarily retail? Are you reaching into clinical spaces? Are you doing immunizations, or when did that kind of departure from just traditional fill and bill retail start to bubble up?
Well, yeah, I think traditional fill and bill retail was also always part of the core. It's the core of the business in a sense, but we always had a really deep clinical integration. I've been really blessed to have incredible relationships with the providers in our county. So we've always been a resource for them on dosing and advice on, what product to choose for a patient to make it more cost effective. And so we've done immunizations from the start, but yeah, once COVID came about, the health department sought us out to really help get heavily involved in testing and vaccinating. So I think to date, we're well over 30,000 tests and similar number of vaccines. And so, yeah, we've only continued to build on that model with travel medicine and other types of clinical services, tuberculosis testing that we're implementing here soon. We've always had a strong clinical foundation. It's always been who we are, and even more so now.
Nice. So, it is interesting. I feel like in a small community, we hear like that there's a little bit different relationship within the local healthcare ecosystem between pharmacists and local prescribers, where a lot of times when you have that kind of, larger ecosystem, that you don't have the personal relationships, you hear that pharmacists may, be like perceived as second guessing or threatening or questioning local physicians, instead of working and relying on, hey, here's this amazing wealth of resource, of knowledge, of pharmaceutical advice that I can tap into.
No, absolutely. I think a lot of that comes down to how, there's all kinds of strategies on how you can approach docs and talk to them. And really we need to work hard to not come across as, questioning or being a burden to them, but really, hey, we're a resource here for you. So, how we phrase things when we call docs, hey, we'd really like your opinion on this, versus what the heck were you thinking when you wrote this strain? Those kinds of things go a long way. But also, we get out there, we bring goodies to their office, and, you work hard to to get past the receptionist and actually get some FaceTime and introduce yourself. And in a small community, it's just easier. At the local football game, you're going to run into 10 of them, and you make it a point to chat with them. Or at the Rotary auction or the hospice auction, you're out there talking to them, shaking hands and kissing babies. Kind of like a politician would. That's how you build those relationships and that trust over the long term. And it's not something that you can just come into and a week later you have it. Those relationships take years to cultivate and maintain. And soon enough, they're relying on you for advice. And once they do, I think once most providers get a taste of having a pharmacist as a resource, they never want to let it go. So that's really fun. I know for our pharmacists, they're kind of doing what they always hoped they would do in school, is practicing at the top of their license.
Yeah. So were there like specific kind of areas that your pharmacy has focused on, maybe, like a podiatry clinic that you've really built relationships and kind of focus on, their needs as their prescribing needs for that sector, or have you just kind of been more general in the community?
I think our focus has been focused mostly on primary care. Quite honestly, yeah. In my mind, primary care is its own specialty, right? It doesn't get, primary care docs don't get the glamour and the recognition that a cardiologist might, but they deal with they're just like us, generalists. And so trying to work with prescribers, because the most complicated patients that you typically will see are, your complex diabetics. So letting them know, hey, we can help provide all the education on your injectables and the products that you're not nearly as familiar with. That's where our focus has mostly been. So focusing on those docs, focusing on docs, especially that we have 340B relationships with, because that really helps the pharmacy too, helps the whole healthcare system in our area. So, and with the majority of our providers in this area being from large systems, getting access to them can be a little bit more difficult, but because we have those longstanding relationships, we're able to get in and talk to them and set up lunches and meet with them.
Nice. So are you finding, that the communication with those physicians goes beyond, initial feedback on a new prescription, or are you, communicating after that fill or on the third refill about the patient's lab values and feedback going both ways?
Absolutely. Right. Yeah, definitely case dependent on the patient, but, it's not every patient that you have those conversations about, but certainly, on ones whenever an issue comes up, it's a quick call or fax over, and then it starts the discussion. And the docs have been really good about getting back to us and actually having those conversations. So I do feel like we're able to really move the needle in terms of outcomes. And so the next step is, trying to get a formal agreement set up with a particular practice or provider group to funnel those complex patients to us. And let's see how we can document and prove that we're really able to get patients to their hypertension goal or that A1C goal, which there have been numerous studies across the country that have proven that. I just really like to do it locally here because I think that would just, we need all the data we can get, right, to show just how important we are.
Yeah, so that's one of the big conversations you always hear is, getting paid for, the work that you're doing outside of filling prescriptions, getting paid more on a performance or results base. But you have to have that data. So like how are you able to quantify that care and share that progress?
I don't have that at this point, right? We haven't really done any formal studies. We're working on several with the Washington State Pharmacy Association. There's a hypertension grant that we're participating in, and then some other, smaller CPSN type agreements with medium to large size employers in our area where we'd like to bring in hypertension and diabetes type of programs. But we're lucky enough in Washington State we've had provider parity and been recognized as providers for several years. We just haven't done much with it, at least in our pharmacy. We were focused on COVID, but now that we're on the other side of that, I think for the most part, we've turned a lot of attention this year on getting credentialed and enrolled with the payers so that we can start to hopefully bill for the things that we're already doing and receive some payment for the cognitive services, not just for the prescriptions. But I'm also, I don't think I'm one of those pharmacists who wants to get away from dispensing. I think it needs to always be there because that's our gateway to seeing these patients. But we should certainly start to see some reimbursement for the things that we're doing every day that take up time and provide tremendous value to patients. So we've been working with a third party, AssureRx, who's been great in helping us get credentialed and enrolled, and they'll help us with the EHR and the billing and the revenue cycle management, because this is going to be a completely different beast for us. It's not something I understand or pretend to understand. So having their help to walk through this and learn, like, hey, this is what we can bill for. This is what's worthwhile to try to bill for. It's going to be a really exciting learning process over the next year. I hope to really have some good results to report back to you, this time in 2023.
Yeah, I mean, so you're doing some things to capture that data now, right? You're taking blood pressure readings, you're updating those lab values, which, is hypertension seems to be one of the most accessible disease states that a pharmacy can use that month-to-month interaction with the patient to keep them moving in a positive direction, and one of the easiest to probably chart with, getting those blood pressure recordings. So where do you, where do you see that those services being applied? Like, what do you see as the most kind of accessible? And I guess in Washington, you guys are a step ahead in that area. So are you looking at maybe chronic care management or wellness visits? Where do you think the low hanging fruit there is?
Gosh, I don't know exactly what the lowest hanging fruit is going to be. We're looking at all avenues. So we're working with a local provider to place a pharmacist into the clinic, a MENA's type of model where we will be doing annual wellness visits, and that's one arm of it. But within the pharmacy, it's chronic care management. It's hypertension and diabetes management, and also billing MTM codes for CMRs and the types of stuff that you'll typically run through an outcomes type platform. We can do those in the pharmacy and bill our time for them. At least that's a theory, and that's what we're working with AssureRx on, is to try to prove that model that, hey, this is a viable model. Trying to bill vaccines on the medical side and see, if that's a worthwhile process or if we just stick with the way we've been doing it, over time. I think there's a lot of uncertainty and unknowns in that area. It's sort of the holy grail that we've been talking about for a long time in pharmacy is, billing on the medical side as medical providers. And I feel like we're just on the cusp of that. We're just about there. So I'm hoping that we'll be able to start billing for these services midway through October, and we can see, what the process looks like. And it's going to be totally different, right? We're so used to F12ing something, in D.0 format, and you instantly know how bad it's going to be typically.
Right.
So here, right, like having that longer period of waiting and experimenting and seeing. But the way I look at it is we're already doing all of these things. It's not like I'm hiring a pharmacist to come in and paying their time and it's this really expensive experiment of seeing how it pays out. It's, we're already providing these services. So it's just a matter of trying to navigate with the payers of how we can get paid for what we're doing.
Yeah. Yeah. So you mentioned Amina, and I keep a count of, it seems like every podcast we do, somebody just mentions her by first name only, but Amina Abubakar with the Avant Institute, who he was referencing there. And it is interesting. I remember years ago speaking with Beverly Schaefer about provider status and how cool it was that she can, not only, record lab values or provide a point of care test, but she could actually act on that for a set of, predetermined ailments. But that's really kind of that first step of, provider status is being able to say, yes, you do have the flu. How about I do something about it and go ahead and write you Tamiflu? But now being able to say that, I'm going to actually chart and do all of the things for chronic care management that are already billable. I already have that status. So it's going to be neat. Right now there's a few different solutions we see out there. We see, interfaces with basically third-party intermediates like TransactRx coming into Pioneer RX now. We see pharmacies setting up their own EHRs just to be able to have access to those tools and go through the credentialing there. A lot of different ways we're seeing those solutions come about. And you mentioned AssureRx as your current solution. So do you see pharmacies being able to, just fire off an e-care plan that's disseminated at some point, or do you think it's going to be maybe almost like filling a prescription with new data fields. I'm curious to see where, as a pharmacist, do you think that what that looks like in 5 years?
Yeah, I wish, I would hope it would be as simple as, because we're so used to working within the Pioneer type of workflow and having things quick and easy. I don't know if that's possible. I think that the way, physicians and nurse practitioners and physicians assistants document and bill is very different than how we practice. So if we want to get paid like they do, we're going to have to adopt some of that, right? We can't, it's probably unrealistic for us to think that we can change that entire industry and bend it to our will. So there's probably going to be some in between there. I think that the claims part of it is one really small piece. I think the credentialing and enrollment, quite honestly, for me, has been the most confusing part. It is this, I'm used to my PSAO sending me the sign this or don't sign this sort of letter. And it takes the guesswork out of it. You don't need to, Benjamin Jolly understands it, but I have no idea what's going on, right? So if he says sign it, I'm going. But with the medical credentialing and enrollment, we don't have the PSAOs to help us through that process of even how to get started. And each state, quite honestly, is so different. So I think that's where these partners, the AssureRx's of the world, or whoever you're using, can really help you get through that, until at some point there's enough people through the system in each state that it's a little bit more, I guess, their steps are spelled out a little bit better. Right now, I feel like Lewis and Clark marching across the country, you're just kind of learning as you go. So it's been great to have help doing that. But as far as the claim side, we do need a way to streamline it, because we know pharmacists are busy. So it's unrealistic for them to spend a half an hour with documentation. We've seen, like, you guys made tremendous improvements on the e-care plan side of things. It used to take us, forever to submit one. Now it's a lot easier. And so over time, as more people do it, I definitely think we're going to see some streamlining. But I think it's also probably practical to assume that workflow is going to need to be a little bit different for these types of services, just like our training is going to be different, and how patients walk into the pharmacies is going to be different for these types of services.
Yeah, for sure. So, how do you go about even approaching a patient who is so used to a big box pharmacy experience? How do you realign those expectations and let them know that, hey, we're going to do MedSync, we're going to have an appointment-based model, and I can, take care of all your vaccination needs, your travel vaccines. How do you completely kind of wipe a preconceived notion of an industry and reestablish that?
Yeah, I mean, that's always a challenge. But I think once patients walk through our door, they instantly know something's different, right? I think sometimes we're so friendly to the point where people think that it's a little sketchy. Like, what is this guy going to try to sell me a timeshare or what? So once they're they know that this is a different experience. And then over time, we can't bombard patients with all that at once. It's, hey, let's get you into the system. Let's get you on sync. And this is what sync is, right? It's not just auto refill. It's an opportunity for us to really look at everything and have a better clinical picture and set up a time to talk with you each month. And then showing them what else we can do. So all that comes down to just smart marketing, which I'm not the best at, but we try. We're super active on social media, just telling patients, what we're doing, what's new, what's not new. Hey, we've been sort of blister packing or Mediset packaging medications for 20 years, but you might not have known that was even an option. So just letting them know within the four walls and outside of those of what's available to them. And each visit that they come in every month to pick up those medications is another touch point with a bag stuffer or a conversation of, hey, I think this is a good service that you could benefit from, or your mom or dad might be able to take advantage of. So slowly but surely, I don't want to inundate anybody with that. It's not a boot camp type experience where we're trying to indoctrinate you into independent pharmacy, but I think they immediately get the vibe that there's something special here, something different at this place.
Yeah, and that's interesting too. Just that being able to offer so much that you lose the message with offering too much at once. You can definitely overwhelm and miss out on some of those opportunities. You mentioned your social media, and I think that's neat because I was looking at your Facebook page, and this video came up, and I was like, Oh man, I thought Chris was cooler than this. How could he have such a pretentious Lamborghini on his opening video? Like, what is this guy? And the camera continues to zoom out, and it's a Power Wheels, with I'm sure somebody's child there at the pharmacy driving around.
Yeah, my daughter. Yeah, and it's not even my toy Lamborghini. I had to rent it. I can't even afford that little one. Talk to John Heyer about that, but no, it was that kind of stuff is super fun to do, right? Like you take the marketing and you just have fun with it, and people love it. And so we've done several videos. We did some videos on COVID vaccines, on our medication disposal box. You just kind of think it, whatever idea, the dumber the better, I think. And you just have to get comfortable with making a fool of yourself sometimes, or if you put your daughter in it and she's super cute, I mean, you can do anything and it's a winner. So.
Oh yeah. Yeah. That never hurts. Yeah. I saw that video and I got a great laugh out of it. I thought it was really, really fun the way you did that. If anybody that hasn't seen it, it's, this Lamborghini that he zooms out, and it's highlighting the pharmacy, different aspects of the pharmacy, the drive-through. I think she gets a coffee from the coffee shop. I thought that was really fun. Another thing I noticed when I was looking at your website is that you had some really great photography, nice web design. But then when I go to the Facebook page, I recognize all the people, so it's not stock images. It seemed like, okay, this is an authentic, family ran business in the community. And I think that's an easy thing to overlook, and just maybe grab some stock images or try to be a little bit sterile or separated and not have, to separate the business but I think the authenticity of that family engagement comes through in a really, really positive way.
Absolutely. Yeah. We don't do stock images. I'm not a believer in that. That's what the big box guys do. I'm lucky enough to have a background in professional photography. I shot weddings for several years out of pharmacy school. And, I built websites for various companies as we started them and started other businesses along the way. And so we're able to do all of that in house and update it. Not everybody has that ability, but, it doesn't need to be a great photo, like web resolution, your iPhone is good enough. So, take some good photos in portrait mode, give them to whoever's doing your website and have them put it up there. I mean, people, they want to see you. They want to understand the personality and the passion behind the business. And I truly believe people, they want to rally behind companies that they believe in, the Patagonias of the world and the Shafton pharmacies or the Palm Harbor pharmacies. It's part of the community, and they're proud to support it. I mean, people come in and pick up shirts and sweatshirts that we have, and you'll go to a soccer game and you'll see people wearing your logo. And I mean, that's the ultimate compliment to me. But at the same time, as we grow, I was always for a long time the face of the business. And so it's also a strategy of how do I pull myself out of that so I can let my staff shine. So as much as we can, social media, we try to make it about the staff. They're not as comfortable being on the camera or being on social media. So in the end, I end up doing a lot of it, but we're trying to build it. The pharmacy is not just me. It's a whole team of incredible people that really, I mean, I'm not on the bench anymore. I don't even know how to fill a prescription. I staffed last week and it took me an hour to check 3 prescriptions. So it's truly like these other individuals that do so much great work. They are the pharmacy. So, it's a balance of my face on there, but also trying to separate myself so that we can grow and maybe add additional locations in the future and still have that community feel, but not be based on one individual.
Yeah. So that's an interesting, kind of reoccurring theme that we see here when we talk to the pharmacy leaders. There's a point where your job becomes, managing something bigger than the bench duties every day, right? Like you have to be working on your pharmacy, not just working in your pharmacy to be really that next level. So tell me a little bit about when you made that decision, how you saw that need develop, and then that's a big plunge to hire another pharmacist. If you're an independent pharmacist, if you're the running the bench, that's a big step.
Absolutely. I mean, yeah, when you're on the bench, it's all encompassing. And I think the way independent pharmacists practice, especially, I mean, it's 100% of your effort and energy is focused on that, to the point when you check out at the end of the day, there's not a lot of energy left over to work on the business or develop new programs or bring new services in. So yeah, I mean, we made that conscious decision that, hey, we're going to hire this person, we're going to add it to the budget, and we are going to see, one, how it performs, and also how it makes me feel. And quite honestly, it gave me the mental clarity and headspace, and I truly love what I do now and how I do it, that I can be in the pharmacy, but I'm working on other things. I'm giving my pharmacists the tools they need to practice at the top of their license and provide our patients with great care. And, I had a lot of great mentors along the way that have multiple stores, and that's really the only way to do it, to continue to grow. I mean, it seems like every day now, everybody has multiple stores. I'm kind of slacking here with one. I try to figure out what I'm doing with my life, and what went wrong. But, it's once you're off the bench, you can look at things in a completely different perspective. And yeah, it's a little bit easier. You're not in the weeds. And it was getting to the point, looking at reimbursements coming through on every prescription, that you started to lose the passion and the energy for it. So now, I still see that in an aggregate in a report, but I'm able to deal with it more in an analytical way than an emotional way when I'm seeing it, on a patient by patient basis. And yeah, it's just a transition in your job, right? My job title from pharmacist on duty to just, I guess, manager in charge.
Yeah. No, that's really interesting. I mean, that enables you to go out and find those new opportunities and concentrate on, the important, and because there's always the urgent, 20 prescriptions that need to be checked, patients waiting, and urgent is going to win out over important every day.
Absolutely. Yeah. There's no shortage of fires, right? Even in a heavily sync-based pharmacy, with an appointment-based model like ours is, stuff always comes up. And so, yeah, there's not a lot of bandwidth left over to work on point of care testing or bringing in these services that honestly at the outset seem kind of daunting because it's such a departure from what you do. So having me just in my office cooking up an idea, and then I present it to my now overwhelmed pharmacists so they can have that feeling, that's my job now. But also providing them with the tools so they feel like they can take on those additional projects, right? Like we have to look at efficiencies and workflow so that there's time left over, with each patient to spend with them. Like my rule is, if you want to spend 15 minutes with a patient, do it. Like we just have to structure our day so that we have that freedom and flexibility to have that quality time with patients.
Yeah. So you started out 2018, a lot of personal medical issues to get through, planning out a new pharmacy, find a new pharmacy, remodel, move in, all during COVID. It sounds like you're very, very good at multitasking and used to having, every burner at full blast. So what now? What happens when COVID winds down? The paint's dry on the walls. The coffee is brewing every day at the coffee shop there, and things start to approach a new level of a new normal. So I have a hard time imagining Chris Schaffner letting things hold a status quo for much time. So, I see the medical billing is big on the plate. What do you see in the next couple years on the roadmap?
Yeah, I think medical billing will be a big focus of ours. Absolutely. I mean, and to your point, I'm looking forward to a new normal, right? Because a new normal allows us to continue to innovate, where we're not just, banging out 200 vaccines a day, which is also fun. So yeah, medical billing, working with a couple of independent providers' offices to place pharmacists in there. Again, that Amina model. And I say Amina like she has no idea who I am. I just know her name. But working on that. Gosh, we bought another coffee shop in another town last week. So, and we're looking at hopefully acquiring another pharmacy here in the next month or so. So continuing to grow and look for opportunities. I think that there's always something. Yeah, once one project, the day I'm done with a project or getting near its completion, I'm looking for the next thing. It probably annoys my staff and my family, to no end. But I think I have to have like a coffee business to support my hobby of pharmacy. So we'll keep growing on that front. and keep working on whatever comes our way next.
So if you don't mind sharing, it sounds like you're in the middle, but what do you what gives you confidence? What are the green light, the accelerators, the things that say, yes, this is the good option for multi-location. This is the second store, or maybe this one doesn't meet the metrics I'm looking for, or there's a threshold that I haven't met that makes me feel comfortable doing this. Like what's your green light on a new pharmacy, on a second pharmacy? Is it a startup? Is it an existing, or does it matter?
I wish I had like a more like Harvard MBA type approach to it. Unfortunately, like I'm more of like a back of the napkin kind of guy, but really for the pharmacy we're looking at now, it's the feel from the community. I think it's a very similar community to where we are now that would truly appreciate the type of service we bring in. The payer mix is very similar to what we have now. So I know, financially that the volume they're at should help to service the debt essentially on it. It's not perfect by any means. If you put your top 10 list of things you want for a pharmacy, certainly drive-through now is a requirement. It doesn't have that, but there's always options to get creative and look for another bank to remodel in the future. So, it's really it's sort of a gut feeling. And also too, like proximity to my current location, my home, right? I don't want to be spending hours in the car every week driving. Like if I can I shoot over there in an hour or less, right? Is there going to be traffic that's going to drive me crazy and make me throw laptops through the window on the freeway? I try to avoid those types of things. So, just I guess a gut feeling, and it's also opportunity. They sort of present themselves, with other owners looking to retire. You might not have considered it in the past, but sometimes those opportunities just seem to present themselves to you.
Yeah. Is there there's so many different factors that go into that. When you look at the prescription volume, the payer mix, do you see opportunities where you say, oh man, I can see that they're leaving these opportunities open, like these therapeutic classes, or these enhanced services that are underutilized. I'm always curious. It's such a big leap to what really indicates success. But I guess if they were doing it one way and surviving for so long, then there's something there, right?
Yeah, and I think that looking at can we operationalize this a little bit better? Can we make it more efficient, especially on the purchasing side? Can we bring it into a larger group? And that's something we've looked at is with scale, can we drive down the cost of doing business enough that these razor thin margins have a little bit more room in them for us to hire, a pharmacist, one, so I'm not mired in benching duties there, but that allow us, once we prove that this medical billing model is viable, that's another avenue for us to see patients and have access to patients to help provide those services. And at the end of the day, truly, it's a passion too, right? Like it's what we do. You want to bring these types of services to another community that doesn't have it at this level right now. So, mostly I think most pharmacists are really good operationally. They're good at looking at workflow and looking for improvements. And so I think there's a lot of pharmacies that are still operating, how they did back in the 90s. And so if we can utilize technology to look for the opportunities, there's got to be something there that we can develop and maximize.
Yeah, for sure. And so outside of the community, outside of making sure everybody is caffeinated and having that community hub, serving their travel needs and immunizations, it seems like there's also that third leg that we see, from community, from just community engagement, pharmacy services, and then there's that third leg of precepting and advocacy that seems to be one of the pillars of the pharmacy leaders that we talk to. And so you're very involved with CPESN in your state. Also recent award winner for the WSPA Award of Distinction. So congratulations. And then also moving forward with more involvement with your state program as well. So, what do you think that contributes, or do you think that that's a necessary function to, moving not only your pharmacy, but the profession forward?
Absolutely, for moving the profession forward. Honestly, in some ways, it's sort of a chicken and egg type of deal. At first, when we opened the pharmacy, I didn't have the time or the freedom to get more involved in organizations like CPSN and the Washington State Pharmacy Association. But as I've been able to pull myself off the bench, there's a couple hours, a week that you can spend on those things. And the return to the pharmacy, honestly, has been quite incredible, just because, again, it goes back to network. You meet people, and it feels good to help advocate, legislatively and on a policy basis to try to ensure that community pharmacy remains viable into the future. Like, we all know and understand, and I think communities get how pivotal a role community pharmacy plays in the healthcare delivery system. And we have to ensure that it's available in the future. So I really love working with Washington State Pharmacy Association on that, and trying to use my network to benefit them. So I'm currently running for a board of directors position with them. We'll see if I made the cut. So, and it was quite an honor to be recognized for them. I think it was the Distinguished Leadership Award. I kind of joked that I just think they had nobody else to give it to, so they drew out of a hat and I got it. But I'm quite honored. There's so many great pharmacists, not just in Washington State, but around the country, that are just doing incredible work. And I'm humbled to get to hang out with them at conferences and learn from them and try to bring that back home and be a resource for my community and my state association.
Yeah, for sure. Congrats on that. And I know there's definitely no shortage of rockstar pharmacy professionals in Washington. Just our recent lineups, like I said, we've only pinpointed a couple of them. But, I think you're right. As you're stepping off the bench, when you're working on your business, you see these bigger issues and it's like, you know what, how can I fix these bigger issues? And it's not just your pharmacy; it's a state of the industry. So it is really neat to see 2022, 2021. We had a lot of small victories for pharmacies overall. I know Arkansas had a lot of progress, and it's exciting to see.
Yeah, I think this is probably the most exciting time in the last 2 decades, certainly since I've been practicing, of where we're seeing things go from a policy and legislative standpoint. And, it's not going to be a quick fix, right? It's not like overnight the bleeding stops, but I feel like at least we have a lot of momentum moving forward. And now the struggles we've been facing they're publicly acknowledged and recognized and starting to be understood from legislators. And that's the first step in trying to fix that. But at the same time, we all need to be really active in continuing to develop our business and diversify revenue streams away from just dispensing. But hopefully we need to fix dispensing as well, because again, that's the core of what we do. And it allows us access to patients so that we can help them in other ways. And we need to continue to advocate and work.
Yeah, it's definitely one of those things you've heard complaints about low reimbursements and moving to other areas to supplement. But I don't think replace is the key there.
No, it has to. We need it all, right? And I just think how many problems do pharmacists solve every day for patients? We don't even think about how many things we do that help people in their healthcare journey. And so we have to work to remain active, because it would be a sad day to see that disappear. I mean, you would certainly see healthcare in this country, spiral down quickly. So. But it's one of those things, you don't recognize how important things are sometimes until they're gone. So we just need to prevent that from getting there. And that's why it's been so rewarding and inspiring to work with state and national associations on that.
Yeah, absolutely. And it is neat. There's I feel like there's kind of a trend now to kind of reconnect to some of those things, generations like ours that have lost blockbusters, and that's a small part of like our, social fabric growing up that has been removed. And people have taken note of that. I think pharmacy is one of those things that, I think especially after COVID has that kind of renewed sense of, this is part of the fabric of our community and it's important to support.
Absolutely. And kind of like, like you have the Blockbuster analogy. I would argue like streaming services improve that. But, if we go away, mail order does not improve it,
No, no.
So.
I don't know. I was watching Stranger Things and, there's a scene where they're picking out the movies, and that's such an experience that now, that experience is different with streaming. You spend more time just flipping through and then watch nothing. So
I know. I mean, it was a whole thing to go. I mean, I remember Friday nights you go down to Blockbuster and thumb through it, and the movie you actually want's out of stock. And gosh, the struggles my children will never know.
No. So far we've come though. Well, I'm going to let you get back to work. I look forward to checking in with you here in a few months and hearing about the new pharmacy, the new coffee shops, the new flavors, the new adventures. So thanks so much for joining us, and keep me updated on everything that's going on.
Cool. Thanks, Will. It was an honor to be here, and it was great getting to talk to you. Thank you.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow Pioneer RX on your preferred social media platform.